and thank you for joining us again today. I have with me my Deputy Governor for Budget and Economy, Dan Hines, and our IDPH Director, Ngozi Ezike. From the very beginning of our COVID-19 response, my purpose in appearing before you each day has been to fully inform our residents and to guide us through the impacts of this virus, its medical consequences, and its effects on all aspects of our way of life. I've been straightforward with you about what we know, and of equal importance, what we don't know, to make sure that you have the information that you need to keep yourselves and your loved ones safe and to help each other overcome the potentially devastating consequences of this virus. After discussing it with legislative leaders on both sides of the aisle, today I want to review with you the financial impacts of COVID-19 on our state budget and walk you through our early projections regarding the revenue shortfalls that Illinois is facing due to the impacts of COVID-19. As I do so, keep in mind that these are preliminary and estimated figures since this virus is not yet vanquished and there remains so much uncertainty still about when that will happen. Folks, you don't have to be an epidemiologist to see that the virus is going to hit our budget hard, a reality that is being visited upon every state in the United States. The bottom line is this: budget experts estimate that Illinois will have a $2.7 billion shortfall of revenues for this fiscal year and a $4.6 billion shortfall for next fiscal year. Let me dig into those numbers a little so that you can see where the challenges really lie. As a general rule of thumb, state budgets across the United States are dependent upon taxes on income, sales, and other sources, such as lotteries and gaming, for a substantial portion of their state budgets. In every state, the coronavirus pandemic has substantially disrupted those revenue sources. That's true regardless of political affiliation and regardless of how fast or slow a state's leadership moved to implement social distancing measures. Even those few states still operating without a stay-at-home order are facing massive fiscal hardship. This is a public health crisis, but it is accompanied by massive economic disruption that's unprecedented in modern history. Last February, when I presented a fiscal year 2021 budget proposal, my Office of Management and Budget released general funds revenue forecasts for the remainder of fiscal year 20 and for fiscal year 21. With those estimates in hand, I proposed a balanced budget, a budget that invested in our long-term strengths that will lead to our future economic growth: schools, job creation, infrastructure maintenance, human services, public safety. And I acknowledged the intractable realities of Illinois' structural budget deficiencies and proposed facing them head on. That budget proposal represented an essential next step on the path toward fiscal health for Illinois. Based on our new preliminary projections on the economic impact of COVID-19, that path has fundamentally diminished to the narrowest of paths. Let's start with fiscal year 2020. Estimates by our Department of Revenue economists show a 7% drop in our state source revenue. That's the $2.7 billion that I mentioned earlier. $1 billion of that decline is due to the 3-month extension of the April 15th deadline for filing 2019 income tax returns. Because of that extension, those revenues will be received in FY21 instead of in FY20. So in looking to close the FY20 fiscal gap, we have already begun taking steps to reduce expenditures, asking agency directors to enact spending reductions and efficiencies. And I'll remind you that earlier this year, we asked those directors to identify efficiencies when we prepared for the FY21 budget and secured a savings plan of nearly $1 billion over 3 years, much of which our agencies were already moving toward ahead of schedule. That said, my cabinet members are hard at work realizing as much of those savings far sooner. Beyond that, my team has been working with the treasurer and the comptroller to leverage over $700 million in other state funds to support the operations of state government and issue up to $1.2 billion in short-term borrowing as constitutionally permitted in unexpected situations like this one. Both Treasurer Frerichs and Comptroller Mendoza have offered tremendously creative and responsible leadership in shifting our dollars to where they can be most impactful as a response to COVID-19. This is not the path any of us would choose under normal circumstances, but it is the best path available to us with the 2.5 months left in this fiscal year. Our state has made tremendous fiscal progress in the last 1.5 years, enacting a balanced budget, reducing our bill backlog by nearly $1 billion in my first year in office, and reducing our late payment penalties from the $950 million they had reached before I became governor to just over $100 million instead this fiscal year. This crisis, however, will take us off course for a little while, and we must put ourselves back on track as soon as we can. That brings me to fiscal year 2021. With our new revenue projections, my administration is estimating that there will be at least $4.6 billion less in state revenues than our Department of Revenue originally estimated, accounting for paying back the short-term borrowing that we must do in fiscal year 20. Our total budgetary gap for FY21 is $6.2 billion. And if in November the constitutional amendment to move from a flat tax to a graduated tax system doesn't pass, that budgetary gap will expand to $7.4 billion. Illinoisans are all too familiar with the pain the lack of a state budget can cause. So let me just say up front, we will not go without a state budget. We will need to make extraordinarily difficult decisions on top of the difficult decisions that we've already made. But together with the state legislature, we will make them. And we will do so with an unswerving dedication to fairness. In my inaugural address, I said that I would not balance the budget on the backs of the starving, the sick, and the suffering. It's during our most trying moments that our resolve is truly tested. Our moral character as a state is tested. So in the midst of a pandemic, I am more resolute than ever to protect those who are suffering physical and financial hardship from it. I want to express my gratitude to our Illinois congressional delegation, our senators and congressmen of both parties for their support for the first CARES Act, which provides up to $2.7 billion to cover state government expenditures in response to the pandemic. It also provides critical support for Illinois' education agencies, local governments, senior aid, transit systems, hospitals, and many other areas. This COVID response funding is very important. It will directly support our work to secure PPE and ventilators, to stand up alternate care facilities and alternate housing, to help us keep people safe and save lives. But I want to be clear. These dollars can be used to cover only new expenditures related to coronavirus. Currently, this funding cannot be used to make up for state government revenue shortfalls that have been a result of coronavirus. That leaves states to face this unprecedented financial hole on their own if the Congress doesn't pass a CARES Act 2 to support state governments. Lawmakers on both sides of the aisle from across the nation have pointed out that it is absolutely critical that Congress pass another stimulus bill to assist states and territories through this crisis. The federal government acted swiftly to step in and support businesses and corporations so that they can come out on the other side of this and jumpstart the economy. But the same type of action is needed in support of state governments. This is about ensuring that in the wake of this pandemic, the nation isn't facing down a second storm standing in the way of funding for schools and health care, clean water and clean air, greater public safety, more job-creating small businesses, improved care for our most vulnerable children and seniors. This is about the continuity of the essential services that give people a real chance. Last year, Illinois' Republicans and Democrats alike rolled up our sleeves and produced a bipartisan, balanced budget that has begun to put our state back on a sound fiscal path. It's the most fundamental task of state government, and even under these unprecedented circumstances, it must be carried out, and it will be. Responsible leadership on both sides are committed to doing so. Illinois, when I said that we were all in this together, that's true. From Cairo to Chicago, from Rockford to Metropolis, we are one Illinois. But it's also true across the country. We are one nation. And as a nation made up of the 50 states, we are facing, by early estimates, state budget deficits of at least $500 billion, largely concentrated in this coming fiscal year. Our greatest president once said, "The legitimate object of government is to do for a community of people whatever they need to have done, but cannot do at all, or cannot so well do for themselves in their separate and individual capacities." President Lincoln's words ring true today, so we ask the Congress to do for the states what it alone can do to get us through this crisis together. Thank you, and now I'd like to invite Dr. Ezike to give today's medical update.
Thank you, Governor. Good afternoon, everyone. Let me start by thanking our governor for his commitment to the people of Illinois and all the residents across all the communities. I hope everyone is continuing to do their best to stay healthy, not only physically, but also emotionally. These are trying times, but this is an indicator of our resilience. I'm proud of the way that Illinois has responded thus far. But make no mistake, even though we are flattening the curve, we still have a ways to go, and we have to tough this out together. I report to you today that we have had 1,346 new cases over the last 24 hours, and unfortunately, 80 additional lives lost to COVID-19. This brings our total case count for the state of Illinois to 24,593, along with 948 lives lost. During these difficult times, I'd like to share information about recent analysis of early data to offer even just a glimmer of hope. Analysis shows that implementing community mitigation strategies or non-pharmaceutical interventions, NPIs, during this pandemic can and will and has slowed the spread of infection. This includes the measures that we've all been taking: hand washing, covering our cough, wearing a mask. These personal measures have been effective, but also the banning of mass gatherings, the staying at home, the social distancing, the environmental cleaning. These are also key strategies at the community level. These measures are working, even though we continue to see new cases, even though we continue to report new deaths. Remember, this is a marathon. We are seeing a slowed rate of increase. These measures are cumulatively beneficial over time, but we have to stay the course. I'd like to take this opportunity to give a shout out to all the essential workers who are not often thanked for the work that they do to keep our state moving. There are Illinoisans in the fields, on the farms, in the grocery stores restocking our shelves, postal workers, staff delivering the goods that we've ordered online to stay at home, not to mention the truck drivers keeping our country connected. Those working in banks ensure that we have access to the money we need, the people who are picking up our refuse, and so many others who are often overlooked during this pandemic. I salute you all and thank you for your service. We must all continue to do our part to protect the health of all of Illinois. We thank you for all that you're doing to move our country forward. Remember that the actions that we take today will set us up for a better future. We are doing this together. Let's remain all in Illinois. And now I will translate comments into Spanish. Buenas tardes, y quiero dar gracias al gobernador por su compromiso a Illinois y sus residentes en todas las comunidades. Realmente él se preocupa mucho sobre esta pandemia y está haciendo lo que es necesario para mantener saludable a Illinois. Espero que todos están haciendo todo lo posible para mantenerse saludables, no solo físicamente, pero también emocionalmente. Estos tiempos difíciles son un gran indicador de resiliencia. Estoy orgulloso de la forma en que Illinois ha respondido. Pero no se equivoquen. Ya que estamos mejorando, todavía tenemos un camino adelante. Sin embargo, estoy segura de que podemos hacerlo juntos. Hoy, IDPH informa que 1,346 personas adicionales han sido enfermos con el virus y perdimos 80 vidas. Eso causa un total de 24,593 personas que fueron positivos, incluyendo 948 muertes. Durante estos tiempos difíciles, me gustaría compartir información sobre el análisis reciente de los primeros datos para ofrecer un rayo de esperanza. Un análisis muestra que la implementación de estrategias de mitigación aquí en Illinois está retrasando la transmisión de infecciones. Todo lo que están haciendo, lavarse las manos, cubrirse el tos y usar una máscara, el distanciamiento social, la limpieza en espacios comunitarios, el orden de quedarse en casa, todo está trabajando. Puede ser difícil cumplir con estas medidas por tantas semanas y meses, especialmente cuando seguimos viendo nuevos casos y muertes. Pero los beneficios se verán confirmados. Estas medidas tendrán un buen impacto, pero debemos mantener el rumbo. Me gustaría aprovechar esta oportunidad para saludar a todos los trabajadores esenciales que a veces no se les agradece por el trabajo que están haciendo para mantener nuestro estado. Estos son los trabajadores en los campos y en los ranchos, las personas en las tiendas. Muchísimas gracias a todos ustedes. También no te olvides los trabajadores postales y otros trabajadores que entregan los productos que estamos ordenando por internet. Los camioneros, los que trabajan en los bancos, todos están nuestros giros. Las personas que recogen nuestra basura y muchas otras que trabajan durante esta pandemia, gracias por su servicio. Todos debemos continuar haciendo nuestra parte para proteger a nuestros trabajadores médicos y la policía y bomberos, pero también a todos los que trabajan para que nuestro país siga avanzando. Recuerden que las acciones que tomamos hoy nos prepara para un futuro mejor. Haremos esto juntos. Gracias. And with that, I will turn it over to Governor Pritzker for questions.
Thank you very much. Thank you. Happy to take any questions from our stalwart reporters who seem to show up just about every day.
Thank you, Governor. With those numbers, which sound pretty scary, Is it time to rethink the graduated income tax?
Look, it's on the ballot for November. I think people will be making their own decision about it. I would argue, in a way, that we may need it now more than ever. And of course, this isn't just about 1 year. It's about fixing the structural deficit that exists for the state. We're in a pandemic. We're in an emergency. This crisis is causing a significant disruption to our fiscal year coming up. But we have many years ahead, and I think a fairer tax system makes sense to me.
There is a report today about a secret flight of PPE. Can you give us more information? And do you really have to make it secret, because otherwise the feds might take the masks and gowns that you're trying to bring here to Illinois?
Well, look, I'm responsible for making sure that we have the PPE and the ventilators that we need for the state. The federal government, as we've talked about many times, has not been a great partner in that. They've helped, and I want to give credit for what we've gotten from the federal government, but it's only really, in the end, a few days worth of items. And so we've had to search the entire globe to find what we need. Shipping is very difficult, and so we're doing what we need to do to make sure that we get the kind of PPE that we need. It is true that the federal government seems to be interrupting supplies that are being sent elsewhere in the nation, and so I wanted to make sure that we receive what we ordered. And
when will you get that shipment, do you think?
I don't know the days on which those will arrive, but they are scheduled to arrive.
From one of my colleagues, Katie Kim, some states, Iowa, released the names of the senior health care facilities and the nursing homes with coronavirus infections. Why not Illinois?
I'm happy to turn it over to the doctor. The IDPH reports quite a lot about our nursing homes and the infection rate, but I'm happy to turn it over to you.
So releasing information regarding outbreaks that happen in facilities is not something that's new to us. IDPH regularly does put that information out. I will take that back to the team if we haven't been updating our lists.
Thank you. Also, right now, family members with loved ones in nursing homes can only find out if a positive case or death if the nursing home voluntarily releases this info. What would you say to those families who are worried and they're wondering if their loved one is at risk?
Again, remember that this is an unprecedented time, and traditionally we know that we've had potentially some shortages in staff in the nursing homes, particularly among the staff who are sick themselves. So I think in the midst of trying to check every member of everybody living in the nursing home to make sure that they're not sick, to make sure that they're separating people who've been exposed from people who are sick, from people who haven't been exposed, to doing the pre-shift assessments for all of the employees, I think everyone is being tasked with additional duties. So I think it's absolutely the intention in every nursing home to contact families when they have a loved one that's sick and to give updates. I'm going to speak for the nursing homes when I say I probably think it's just backlog, and not that they don't want to, but trying to manage all the tasks in addition to caring for the loved ones that they've been tasked with.
Might you remind them that this is information that folks are desperate for? Surely. Several state senators are urging the lifting of the stringent social distancing when the Illinois Hospital Association says that the ICU bed capacity is sufficient. Is that a factor? Will you consider that?
Again, I've said day in and day out that we're going to rely upon the epidemiologists and the scientists to tell us what social distancing measures, what stay-at-home measures we need to keep in place in order to keep the population from having a spike of COVID-19 infections. My number one consideration is the life, safety, and health of the people of our state. And of course, I am just as eager as all of those state senators and with the President of the United States and everybody else to get everybody back to work. But we've got to do it in a fashion that really works for everybody so that we keep customers safe, that we keep workers safe. And so I'm going to repeat something I've said almost every day. We need widespread testing, and we're all working on that. No state has widespread testing yet, but we are all working on expanding testing. We need a comprehensive contact tracing effort, which Massachusetts has begun to stand up, and that's something that I've been in direct contact with not only the governor of Massachusetts about, but also with the people who are actually putting that program together, who I happen to know for many years, an organization called Partners in Health. And so we're looking at putting that together for the state of Illinois. So we'll have both of those in the works. We've already talked a lot about testing, so you've seen that we're in the works buying machines and the VTM and everything that's necessary to make sure that our testing increases, the contact tracing, and then something that is really dependent upon the researchers and the doctors, and we're cheering them on in every way that we can, but it's really up to them, and that's the testing that's going on right now over certain kinds of treatments that can be given effectively. They have these, what do they call them, double-blind experiments, and some of which is going on in Chicago hospitals, I might add, but it's going on all over the world, on things like remdesivir and hydrochloroquine and everything else. Once we have something established that will keep fewer people from going to the hospital, and therefore fewer people going into ICU beds and fewer people getting ventilators, then I think those three things working together, testing, tracing, and treatment, those together with widely available PPE will help us to begin to reopen commerce across the state.
This is from Tony Arnold at WBEZ. In New York, the death toll sharply increased when they decided to count the victims who never tested positive but likely died from it. Are you considering doing the same thing here? And is it possible the state's death toll is considerably higher?
I'm going to let Dr. Ezike answer more broadly. I will tell you that it is certainly true that the number of cases of COVID-19 is much higher than what is being tested, because we can only test so many people with the number of tests we have. So we should, that's why we have to assume that many, many people have it, and that's why we have a stay-at-home order in place. And so I think it's logical to assume that the number of people who have passed away is higher. I don't know whether I would say much higher, but I will turn it over to Dr. Ezike. We'll give you a more scientific answer to that question.
So for sure, as the governor correctly stated, the denominator in terms of the total number of people who have cases is grossly underestimated. We know that because we had limited supply of the testing materials, and so then we're trying to find our highest risk people in terms of doing the testing in the first place. But on the death number, I think that one is probably closer to accurate, because once you're in the hospital, that's definitely a population that would get tested. Like, that was one of our prioritized groups, people who are very sick, who are in the hospital, who are ICU, who have pneumonia. So more likely, the death numbers are close to actual. Of course, some could have been missed if there was no suspicion at all. But in terms of the numbers that are grossly underestimated, it would be the total number of cases for the state. So the CDC did recently put out the new guidance that we should have a separate column for laboratory confirmed cases, and then this second column for probable cases. And so again, most of those probable cases are the people that physicians and public health departments said, yes, you were the household contact of so-and-so, and this person was laboratory confirmed. Yeah, you probably have it. So we know that those people exist, and so it's just a matter of, do we want to increase those numbers? But even that will probably be a gross underestimation if we just put those probables.
We've had a couple of, Dr. Ezike, folks who say they have been tested, they're essential workers, this is especially at Roseland Hospital, and they're still waiting for the results. They did self-impose a quarantine, but now they have to get back to work. Their employer's saying get back to work. What should they do? So
I actually have been in contact, I think, with the VP of Roseland as recently as today. And so I am working with my team to make sure that all specimens are sent directly to IDPH lab, because again, the rapid turnover of the results is essential. And so when people send it out to some of these other locations where there's an exorbitant amount of time, decisions can't be made. So we're working on that as we speak to make sure that we get timely results.
Thank you.
And may I add to that, because I think this is an important part of the answer as well. There was an article actually this morning about how the commercial labs actually are reporting 30% fewer results than they were before. They've had their own issues with processing. And I've talked about this before, how it takes 7 to 12 days to get a result from one of the commercial labs. It's the reason, partly, that we've started to build up, not just started, we've been doing it for some time now, building up our resources within the state. It's not just because it's closer by location, because it's not about driving time or
Good afternoon, and thank you for listening again today. As of 2 p.m. today, there have been 4,895 positive cases of COVID-19 in the state of Missouri, including 147 deaths. Over 49,000 Missourians have been tested so far. Last week, I announced that school buildings will remain closed for the rest of this academic year, while learning and other school services continue to be offered to students at a distance. We understand this is difficult for students, families, and educators, and this was not an easy decision. But we believe it was the right decision, not only to continue protecting the health and safety of Missouri students and teachers, but also to give educators time to transition into remote teaching and learning solutions. We know remote learning looks differently in every district across the state, but I want to thank all of our educators, as well as our families at home, for stepping up and finding creative ways to continue educating our students during this difficult time. On Monday, we received confirmation from the United States Department of Education that Missouri will receive $208 million under the CARES Act to help schools with COVID-19 related needs. Additionally, we also received notification yesterday. Missouri will also receive $54.6 million from the Governor's Emergency Education Relief Fund authorized under the CARES Act. These dollars allows us to provide emergency support through K-12 schools, higher education, and other education institutions impacted by COVID-19. Today, Commissioner Van Dieven is here with us to provide more details. Commissioner?
Thank you, Governor Parson. Since March the 19th, all Missouri public school buildings have been closed, and schools have been transitioning to providing remote teaching and learning opportunities for their students. Throughout this time, the Department of Elementary and Secondary Education has remained committed to removing barriers and advocating for flexibilities so that school leaders can remain focused on the health and safety of their students, staff members, and communities, while continuing to provide distance learning opportunities and other support services for them. For most in education, and for most of our families at home, this is a new way of doing business, and we have adjusted at an accelerated pace. As with any unanticipated change, there is a financial cost associated with it. And that's why I'm pleased to stand here today with the governor to talk about the confirmation that we received from the U.S. Department of Education that Missouri will receive $208 million from the Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act, to help our K-12 schools respond to these needs. These dollars will help Missouri schools address the digital divide that we are experiencing, particularly in our rural and urban areas, as well as to address the remote teaching and learning challenges and lost learning time experienced throughout the state as a result of COVID-19. These K-12 funds will be distributed through the federal Title I allocations, which means that the funding will be sent first to those schools working to meet the unique needs of those who have traditionally been most disadvantaged. Additionally, last week our team applied for and received approval of a federal waiver authorized under the CARES Act that gives Missouri schools unprecedented flexibility in using the federal title dollars they already have to best meet the needs of the students and education during COVID-19. The new flexibilities allow schools to repurpose existing K-12 education funds for, among other things, technology infrastructure and teacher training on distance learning, and to move resources to the areas of highest need during this national emergency. We are grateful for the additional funds and for the needed flexibility, and look forward to continued work with the Governor's Office, the Department of Higher Education and Workforce Development, and other state agencies for a coordinated state response. And on a programmatic side, as we speak, a task force of leaders from across the state are working to propose viable summer school options, while other entities are working to determine what re-entry into our school buildings will look like. Not only do we need a consistent plan to ensure that students and educators across the state return to school safely, we need to be prepared to quickly address the educational gaps and the enhanced social and emotional learning needs that may surface among our students during this time. I continue to be proud of our school leaders, teachers and counselors, food service workers, and the other school staff members, as well as our Missouri students and their families, for the many ways they have risen and will continue to rise to the occasion to tackle the challenges presented through COVID-19. Thank you.
Margie, thank you very much. Thank you for what you're doing and for representing all the teachers and students out there. And I've still got hope them seniors are going to walk down an aisle to get that diploma before this year's over. We cannot thank Missourians enough for their efforts and commitment to following the stay-at-home Missouri order. Stay home and reducing public contact is still the most important step we can take as we continue to fight COVID-19. However, I want to remind everyone that this does not mean you must stay inside your home and never come out. That is not healthy for anyone. Spending time outdoors is good, not only for physical health, but also our mental health. We encourage Missourians to get outside and enjoy the fresh air. Conservation areas, nature trails, boat access remain open to the public. And the Missouri Department of Conservation has taken several precautions to ensure Missourians can still safely enjoy these activities. Today, Director Polly is here to give us an update on the department's COVID-19 response. Director Polly.
Thank you, Governor, for the opportunity to provide an update today from the Missouri Department of Conservation. So the good news, as the Governor mentioned, conservation areas and nature center trails and boat access sites do remain open to the public. Signs are posted on these areas to ensure safe physical distancing in the outdoors. And MDC continues to monitor visitor usage on our areas. Many trails across the state are seeing increased use, especially on warm and sunny days. And I would personally like to thank the Governor for ensuring time outdoors with the proper social distancing precautions is still available for Missourians across the state to take advantage of. This aligns perfectly with the most recent CDC guidance that encourages individuals to use parks and trails and open spaces safely as they are able, while following current guidance to prevent the spread of COVID-19. This is so important right now because there are incredible health benefits to being out in nature. Research has shown time and again that spending time outdoors can improve your physical and mental health, including decreasing stress levels, anxiety, and depression. Nature can be that bridge to health. In these challenging times, we need nature and fresh air perhaps more than ever to help us de-stress and to help connect us with those we love the most, whether we're walking on a trail or bird watching in a park, fishing in a pond, or out in the woods listening for turkeys gobbling this time of year. So the outdoors are open in Missouri, and we hope it'll be a place of great healing and connection in these tough times. Another opportunity to get outside will be spring turkey season, which starts Monday and will run through May 10th. But we do have areas of impact. Our MDC regional offices, the department headquarters in Jefferson City, our staffed shooting ranges, our nature centers, visitor centers, and educational centers around this state will continue to be closed to the public through April 30. While MDC offices are closed for general visitation, offices will still be staffed, and so visitors with official business will need to notify the office to gain access. MDC public events and programs around the state, including hunter ed classes, nature center programs and events, shooting range programs and events, and landowner workshops will also be canceled until April 30. Our Conservation Commission approved a waiver of all fishing licenses from March 27th through today, April 15th. But though the free fishing permit waiver ends today, the daily trout tag waiver will be extended at the 3 open trout parks until further notice. Related to communications, we continue to work in collaboration with all other public land agencies in Missouri, including weekly joint communications to share impacts from COVID-19, including any changes or closures. In collaboration with Missouri State Parks, we've created a radio and video PSA emphasizing the benefits of getting outdoors right now while abiding by physical distancing precautions. And we're working with stations around the state to help us share that message. So we appreciate all the media has done to ensure that we are spreading that message effectively. Finally, for the latest information on areas and programs that have been impacted by COVID-19, you can go to MissouriConservation.org and click on the COVID-19 response. Thank you, Governor. This is all I have for an update today.
Sarah, thank you very much. I couldn't help but think when you were speaking up here how much I miss the outdoors. It's been a long time, seemed like being out there. And I'm sure there's a lot of other people feel the same way in Missouri. But thank you for what you and your agency does over there. Let's open it up for questions, Kelly.
All right, thank you, Governor. The first question is from Connor Hirsch, which is ABC 17 News. Smaller counties and rural areas struggle with access to health care, and those populations are ranked as more socially vulnerable to the COVID-19 crisis, as many are lower income populations. How is the state prepared to help rural communities and counties who may not have easy access to health care and testing?
Yeah, I think that's one of the reasons we put up like 90-plus mobile sites across the state, trying to make sure we address that issue. How we're encouraging people to use telemedicine and how we're seeing that more active where those services are possible there. But I think every day we're taking a look at rural Missouri because it's one of the concerns we have in all those areas. So every day we're taking a look at that, trying to figure out what services we can do better. But the good news in rural Missouri, there is a lot of agencies anymore that you can go to in testing. When you have problems, you can go to at this point. So we're trying to work on that every day.
All right, thank you, Governor. This question is from Andy House, KQTV. As more meat processing plants across the country are closing due to employees falling ill with coronavirus, are you in communication with any processing plants in Missouri regarding the threat coronavirus poses to their employees and communities?
Yeah, I get briefed just every weekly from the Director of Department of Ag. Chris Chen stays on top of that every day to make sure what is their needs, how are they keeping people employed, and how they make sure them process plants are staying open here in Missouri. And through the business sector of it, the people that are running those plants are doing a good job trying to make sure those people have that social distancing, making sure they're safe. But the director's on that daily, making sure, especially with the recent events that happened, I know she's been in contact with them and other agencies across the United States, plus here in Missouri. So I get briefed on that weekly.
All right, thank you, Governor. This question is from Asa Frankowitz, Campus Reform. At MU, as a result of the budget cuts, staff are no longer given raises or promotions, and there are no new hiring going on at the school. How do you, Governor Parson, and the government plan on fixing this problem in the future?
Well, first of all, let me just say thanks to President Choi up at MU for the job he's doing, because he specifically mentioned MU. But all our institutions had to take a cut in funding. I think the one thing we do is in the future is we try to make up that funding, which we always have, trying to figure out how do we put it back. But look, right now everybody's going to have to take a cut. There's not going to be many exemptions from that as we move forward, especially going into 2021. So when the revenues come up, when people go back to work and we start getting back to some sort of normal, then we'll try to figure out how we get that funding back. But until that time, presidents like that's going to have to lead and figure out what they can do and how do they be a better manager of what they do have.
All right, thank you, Governor. This question is from Brian Hosworth, MissouriNet. Governor, Democratic State Representative Rasheen Aldridge is blasting the Senate Majority Leader's announcement that Missouri lawmakers will return to the Capitol in Jefferson City on April 27th. He has safety and health concerns due to COVID-19. Do you believe it is safe for lawmakers to return?
I do believe it's safe for them to return, and I think that decision's up to the lawmakers. They're all elected officials who represent certain portions of this state, and I think it's important right now in times like this that they figure alternative ways to be able to have those sessions. And I hope they can figure that out, and I hope they do, because there's still work to be done every day here at the state. State keeps on evolving, state keeps going. So I look for them to be back, and I think they will, but I think also they'll take precautions to make sure people can be as safe as they can when they come back to the Capitol.
All right, thank you. This question is from John O'Sullivan, KMOV. He has several questions, so I'm going to ask you the first three. There are calls for you to reopen the state park. Where are you on that right now?
Well, I think we evaluate on the state parks every day, which, we had some problems with some of them that we closed early on, but I think we're looking at that. We're going to open them up as soon as we can. I think quicker maybe than later on some of those, but we want to make sure people can go out and get activities, what we're talking to today.
All right. Franklin County announced today it is making plans to open up things next week. Do you recommend they keep moving forward?
I think every county is going to have to make that decision of how they move forward. But right now, I think it's very important to look at the data that we have, the information we have on moving those decisions, making those decisions going forward. I think it's important, and I think in the next week or two, you're going to see some significant change in the information we have here in the state of Missouri. It's going to help us all to make some decisions in the near future.
All right, and his last question. Last night, the president said there are 29 states that he thinks can move forward on getting things moving on the economy. Are we one of those states, and what guidance are you getting from the White House right now about reopening?
Look, we're in constant contact with the White House. I was on the phone personally with the Vice President yesterday. We're all looking for ways to move the economy forward, and we're going to continue to do that. And we're all looking mainly, number one, what's the safe way to do that? But look, we got to get people back to work. We got to get the economy going. Here in the state of Missouri, that's critical. So that's just, it's an important issue we're dealing with right now, and we're making plans to reopen the state.
All right, Governor, thank you. This question is from Kurt Erickson, St. Louis Post-Dispatch. Which governors have you or your aides spoken with in the past week about a cooperative effort to reopen the economy?
Oh, my. Several governors. Most of the Midwest governors, all the way from Wisconsin to Dakotas, to Iowa, to Oklahoma, to Kansas, to speak of a few, Arizona. Multiple governors we're in constant conversations with on a daily basis. And we're all really trying to get together to see, okay, how are we going to move forward in the United States, especially in the Midwest, because that's where we all tie together. And what are the common interests that we all have, and how can we kind of look towards moving forward? And we're in the process of that right now, and I think every state has a little different idea how they're going to do that. But I think we are all trying to look beyond the COVID-19 virus and start planning on how do we open up the economy and still deal with this virus, knowing this virus is still going to be around for a while, but we still got to open up the economies in our states, and we're going to do that.
All right, thank you, Governor. This question is from Rudy Keller, Columbia Daily Tribune. Governor, the pace of new cases reports in Missouri appear to be persistent, with about 1,000 new cases every 4 days since March 30th. Leaders in Kansas City and St. Louis are discussing the conditions for and whether they will extend their stay-at-home orders. What are the factors that will influence your decision, and when will you tell Missourians what the rules will be after April 24th?
Well, let me first off say we're in the process of working on that order now. I think you're going to get some new information on that in the near future to do that. But look, I think we're all going to move forward with this as soon as we can, and we're preparing for that day to be able to move the economy forward. So we're going to continue to do that, and we'll be able to say more on that in the near future. All
right. Thank you, Governor. This question is from Robert Cox, the Republican Monitor. The supplemental budget you recently approved includes $1 billion for counties and municipalities. Budget committee members have said the money should largely flow through local health departments, yet the bill has no specific language regarding that statement. What restrictions are there or will there be to ensure these counties and municipalities use the money to support local health departments?
Yeah, I think one thing's going to be, it's going to go to the local levels. We all know that. We're working on a formula now, how we're going to do that, and what are the guidelines of the federal intent of the COVID-19. So that's going to get pushed out, whether it's the county health departments have it, or the county commissioners have it, or the mayors, or whatever control it's under, will be decided by those guidelines and how to do that. But the most important thing is we're trying to get that out to those local levels to help support that. And these health departments across the state have been under a tremendous amount of stress to be able to do what they've been doing over the last 30 days. So we're going to continue to figure out ways to support that. And again, well, we got a lot of work to do yet. This is not going to go away in a day or two.
All right, thank you, Governor. This question is from Jason Hancock, Kansas City Star. Governor Parson, how much have you relied on the advice of your health director, Dr. Randall Williams, as you've made decisions about the state's response to the COVID-19 outbreak?
Well, let me just say this about Dr. Williams. I think every day I've been in here for the past 30 days or however long Dr. Williams has been here. He's been in here every day that I know of, 7 days a week, doing his job, trying to do the best he can for the people of the state of Missouri. And let me tell you, his heart couldn't be any more pure to what he's trying to do for the people of this state. And every day he gets up trying to figure out how he can make this state better for the people of this state. So to ask me my confidence level in him, he's right here with me every day, helping me make decisions to make this state better, and he'll continue to be there making those decisions.
All right, thank you, Governor. This question is from Lucas Geisler, ABC 17 News. Missouri has the 8th most approved applications for the Small Business Administration's Paycheck Protection Program in the United States. Have you heard anything from Missouri's federal delegation on how the program is working?
We actually met with the entire federal delegation yesterday. We had a conference call with all of them yesterday to speak to them, and then a couple of them last night I talked to. We're well aware of that. We know small business is the heart and soul of this state, and they're working, doing everything they can within their powers, one, to help them get through this time and to get those resources available. But there's a tremendous amount of small businesses here in our state, and we got to figure out ways to make sure that process works for them and they get their fair share to open back up their businesses and help them through these tough times.
Okay, and two final questions. Both of these are from Caitlin Rosen from the Kansas City Star. Her first question, Governor Parson, Kansas Governor Laura Kelly said today that she has been in communication with you about setting up a strategy to coordinate efforts to reopen businesses, schools, etc. How have those conversations been going, and have you spoken with any other governors about coordinating plans?
Well, let me go back to the original. We have been talking with Governor Kelly's office. We've been in communications with them for some time on multiple fronts to be trying to do that. Kansas City sits right on the border of both Missouri and Kansas, so it's important for us to be talking about how we're going to move forward on that issue. So we have been doing it. And again, with many other governors across the Midwest, especially governors that relate to somewhat what we deal with in Missouri and how we deal with those problems. So every day we're in communications with people, constantly trying to figure out how we're going to move forward and what our plan is and how we can do things together and what things we can't do together.
All right, and the final question, Governor, for you today. This is also from Caitlin. The New York Governor, Andrew Cuomo, issued an executive order today mandating that all people must wear a mask or face covering in public in situations where social distancing is not possible, such as on public transportation and busy sidewalks. Have you considered a similar mandate?
I have not, and I'm not going to mandate for people in the state of Missouri to wear a mask. If they want to wear a mask, they can. But at this point, it's up to the individuals, what they want to do, and I don't foresee making any type of an order like that where I'm going to mandate people to wear masks.
All right, thank you, Governor. All right, Director Pauly, I've got a couple of questions for you from Lucas Geisler from ABC 17 News. Has the department had any issues with people not practicing social distancing on Conservation Department land?
I would say maybe early on, a few weeks back, especially in the urban areas in St. Louis, Kansas City area, we noted some of our areas were very crowded. But we worked hard to get signs up to make sure folks knew the appropriate guidelines that we were certainly going to be encouraging, and that has made a lot of difference. I think they've also noted that in some cases, local parks may have closed, in some cases state parks many now recognizing that we're taking seriously those guidelines. And so I would say more recently we have noted people abiding by those guidelines.
Okay, and another question from Lucas. Federal health leaders and some studies have suggested keeping distance between people through the fall. Has the department considered how social distancing may affect hunting later this year?
Well, hunting itself lends itself pretty well to physical or social distancing, and so perhaps not hunting activities themselves, because folks usually are pretty good at doing that anyway. But as it relates to perhaps, let's say, a deer season or something where folks are inclined to camp as well, we have our work to do to make sure we are communicating the expectations of those camping in our conservation areas. We already have a number of signs up in those areas. But I think the alternative is to close those campgrounds down, and hunting is a significant part of the culture here in Missouri. We want to ensure that folks have the opportunity to do it, but above and beyond anything else, do it safely. So we'll be communicating as the fall approaches and doing our best to make sure folks are abiding by the guidelines.
Okay, thank you. All right, Commissioner Van Dieven, I have a couple of questions for you. Caitlin Schauhorn from the Missouri Times. Commissioner Van Dieven, she asked, California is considering several measures in regards to reopening schools in the fall, including the possibility of having students split the day into mornings and afternoon shifts, or staggering things like lunch and recess to limit the size of gatherings. Are these measures you're considering as well for whenever school does reopen in Missouri?
Yes, so the Center for Educational Safety, Missouri's Center for Educational Safety, has been looking at what I referenced in my remarks earlier about what should reentry look like. There will be a number of recommendations that could be provided through that group. They are still working with many others across the nation, many others within our state. So no specific recommendations at this point, but that draft document is in existence, and certainly the safety of our children and our teachers and families will be the first priority. There are many ways to implement social distancing, and that will likely look somewhat different in schools across the state, but we do think that some very clear guidance on that would be helpful to each of our districts.
All right, thank you. And the final question for you, Philip Sitter from the Jefferson City News Tribune. Beyond the current academic year, is there anything that families, teachers, or schools could be doing in the months ahead to prepare for school in the fall, no matter what that ultimately looks like?
Yeah, I think there's a lot of things that we can do together. Every day is an opportunity for learning. And so when I was, again, referencing how grateful we are to parents and others who have stepped up to help us in this education process, the first place I would likely send you would be to our website. There's all sorts of activities, and we're adding to that every day, standards appropriate for each age level in the system, and gives you some very concrete ideas on what to do there. If you don't have, you heard me reference digital divide, and if you don't have access to the internet and you're watching this through a television today, know that many of our cities and school leaders are working to provide instructional activities through their local TV channels. We think that's a great way to go. And then we're also, just a reminder, this is a wonderful opportunity for kids just to explore and to learn about things that they like. So we'll be studying and focusing really on literacy. So make sure there's materials in your homes, ask your children questions. We're most concerned probably about our youngest learners. Make everything a learning opportunity, as simple as reading directions for, how to prepare a meal, work on fractions when you're developing, making your cookies, double the batch. Do anything that you can to help children see the learning opportunities ahead. And I think the final point I'll make is, whatever kind of stability we can provide our kids right now is absolutely essential. And so as parents, if we can give them a little bit of structure and help them see and understand that all of this will be behind us. They will need to learn. They need to continue to learn. There's a lot of excitement and opportunity ahead of them. So now is not the time to relent. Now is the time to say, what do I want to learn about, and really go for that learning opportunity as an individual. Thank you.
Thank you, Commissioner. Director Carson? Director Carson, I have several questions. There's from Bridget Lavelle, KY3, Caitlin Schauhorn from the Missouri Times, KRCG, Maria Miller, and then also Lucas Geisler, ABC 17 News. They're all asking in regards to the counterfeit or the PPE equipment that you spoke about a couple of days ago. And some of the questions are, how much were the masks, and did the state pay for them?